Go live. Audio to
Hi, good evening, everyone. Can you please let me know if the audio and video is fine? And if the audio and video is fine, then we're gonna talk about a very, very interesting session that I will be taking with all of you, and that how to prepare for NEET PG 2024 or next. You know, the moment I was thinking of taking this session with all of you, the first thing that came to my mind was कि सर अभी तो 5th March को exam है ना, 5th March is an exam. So why do you want us to focus on that exam, or do you want to focus on NEET PG 2024? What are you doing? So guys, please remember, this session has been specifically planned on the request of two group of students. One is who have completed final year and they are entering into internship, one, and the second is the foreign medical graduates who have recently passed the exam and the result has been phenomenal. So they were now and it's always like when you have reached to a target and then what next, for because we all know that just cracking the FMG exam is not the broad aim. Ultimately you have to go to the specialization. So just to address those two groups, I am making this particular session. Those who are preparing for the NEET PG 2023 exam, please prepare for that. Okay, and one more point that I want to say for the students who are preparing for the exam, because I mean there are innumerable number of messages that I am getting. So just remember, I as a person try to think about what is best possible for the students, and if I'm not supporting on any agitation, don't think about that I'm not thinking about you. If you were agitating about the eligibility for the internship, I am definitely with you and I have tried my level best that all the interns should be made eligible for the exam. Whether I put it onto the Twitter or whether I don't put it onto the Twitter, that does not matter. What matters is what I think. I believe that all interns should be eligible for the exam. Second, I also support the cause that there should not be a delay in the counseling and the exam. I mean, I completely agree with the point if somebody is saying that that the exam is going to happen on 5th of March and the counseling will happen after 31st of August or 11th of August, which is the last cutoff date. If the government is thinking in that manner, it is actually absurd and it should not happen. However, as per my information, I don't think that the counseling, the government is planning to delay the counseling unless somebody files the PIL or so, and the counseling can happen even before the internship completion for some of the students, and the session can also be started like in this year INI CT exam. The session was started on 1st of January, and those who were not able to complete the internship by 1st of January as like the AIMS interns, they joined the session on 1st of February. So the counseling as well as the session can be very well started before that. But yes, however, if the government is thinking that they will take the exam on 5th of March and they will start the counseling on or after 11th of August, it absolutely makes no sense. And in that scenario, the change of the exam date should be considered. I mean, that's my honest, clear opinion with all of you related to the exam. However, this session has been specifically planned for the students who are not targeting the NEET PG 2023 exam and focusing on NEET PG 2024 exam. We are really not sure that what is gonna be exam in the NEET PG in the 2024. It is gonna be NExT or it is gonna be the NEET. So I have planned certain questions for you, which I feel that you might be having. First is, how much time is enough to get a good rank? The second is, what is the difference between preparation for the NEET and the NExT? Do I need to join an institute or can I study on my own? And if I need to join, whether I should go for recorded lectures, whether I should go for online live lectures, or whether I should go for offline classes? If for the offline classes, do I need to travel out of my city or what? That is another question. And I think, Rishabh, that is probably the same question that you have asked. How much time should be given to the theory and to the MCQs? How should I prepare 20th notebook? And what is the ideal time to start writing rank test? Alright, these are the broad points that I will be addressing in this particular session. If you think that these are your queries, then do attend this session. If you think that these are not your queries, then probably go and study. If you have any other question apart from this, do let me know, that I will try to address it. Okay, though the session is being taken on the DBMCI YouTube channel, so obviously it can come to your mind that it will be a promotion for the courses of the DBMCI. Well, it's not. The idea is to basically guide the students in the correct form, and that's what I am gonna try to put forward with this particular session here. Definitely I'm gonna talk about the courses that we can offer to you as the institute also. So first of all, let's talk about this, how much time is enough to get a good rank. Now if somebody asks me this specific point, so guys, there is no one standard answer for this particular part, because there is no standard answer for a good rank. For some student, the rank as a single digit is good. For some student, a rank within 100 is good. For some student, rank within 1000 is good. For some student, the rank within 10,000 is good, so that they can get a clinical seat. So before I tell you good rank, you have to decide that what is the good rank for you. And according to that, you have to think. If you are thinking of a rank as a single digit rank, I feel that you need to have a very, very sound knowledge of the subject. And it usually happens if you have a strong foundation of during your MBBS. If you have read the textbooks pretty well during your MBBS, you know your content pretty well, and then it's an internship time when you can do brushing of all those things. So the session will be predominantly targeted for students who are aiming a rank within top 1000 or within top 10,000, and that is how the session is gonna be planned. And let me be very, very clear to all of you. Okay, so how much time is enough to get a good rank? A dedicated study of 8 to 9 months is a standard time to get a pretty decent rank in the exam. This is for those, let us assume that you have not read pretty well during your MBBS. I am not going to ask you the reason why. There could be thousands of the reasons, but if you have not studied well during your MBBS, now you want to get a decent rank into the exam. If you honestly ask me, I will say 8 to 9 months of dedicated studies are sufficient to get a rank. Okay, now what you need to do in this? So the first thing that is must is identify that what do you want to study. What do you want to study? This point is the core of all the discussion that I'm gonna do, and that is select one source for everything. Okay, one source for everything. Now a lot of time people will say ki sir, no, we have read, we have listened to this interview, this student has got this. So what is the meaning of one source for everything? Ideally you should have a single source that you should be able to cover, but now there is a lot of FOMO. You know that sir, this teacher teaches this well, this teacher teaches this well, this Q bank is good, this component is good, this GT is good. So one thing that we can do is identify one source at least for each subject for theory. Ideally all the 19 subjects should be selected at one place, more or less it is gonna be same. One source for the previous year questions, one Q bank, and multiple sources for the GT. This is first thing that you have to do if you are deciding that you have 8 to 9 months of the preparation time available to you. Okay, 9 months is an ideal time. the lesser you're gonna do, the lesser compromise in the reaching to your highest potential is gonna be there. Okay, but this is something that we have to do, and these are the things that are needed to crack the exam: theory, previous year MCQs, a Q bank, and GTs. That's all. I mean, this is a standard principle that we have to follow. It is to be noted that you have to respect all 19 subjects. Some principle that some of the students have followed in the FMG screening exam will not work here, and that is okay, let's read the 10 subjects and let's read the 19 subjects. Please remember, one of the biggest difference is it is not a qualifying exam, it's a competitive exam. It's a competitive exam, so you have to be on your toes and you have to respect all 19 subjects. Okay, so how much time is enough? I think we have already spoken about it. Now let's see this broad division. You have got 19 subjects. As such, there is no division of the number of questions that are being asked in the exam. But as of now, if I'm going to talk about the NEET or the INI-CT, I know that 200 questions are going to be asked in the paper. Okay, I'm going to take up this, whether the NEET is going to be there or whether the NExT is going to be there. I have some answers for you for this session or for this point also. Okay, so expected number of questions, if I'm going to put it, this is the broad way. When I've gone through a lot of papers, that's a rough sum up that I have identified, that this is the number of questions that are gonna be there from individual subject. Please remember, it is practically not possible. When I took recall sessions, I say that 24 questions were asked from the radiology. Okay, but out of these 24, 8 were core radiology, 16 are integrated with the other subjects, and that is why I have given 8 questions to the radiology. Similarly, when you attend a pathology session, probably Dr. Praveen will say that 35 to 40 questions were from pathology, 12 will be core broadly from the pathology, and the rest will be integrated with the other subject. So that is how I have broadly divided them. The clinical questions I have deliberately put up into the medicine, surgery, OBG. Even if there was an overlap, I have tried to put them into this. So broadly, just to give you an idea. Okay, so this is a very important list for everybody, and I would want you can take a screenshot of this, or maybe I will put it into the section. I'll just remove my photo for a second. If you want to take a screenshot, you can take a screenshot, and that is something that I prepared during my time, that how I am gonna decide that from where I'm gonna read the individual subject. We did not have the luxury of availability of so many resources during our time. However, now you have a luxury also and a problem also, and that's a problem of plenty, but that's a broad thing. If somebody can read from the textbooks, nothing can be better than that, and that's how I am gonna suggest them to read them. As I've told you, you can take a screenshot of it. I'm once again removing myself from the screen. You can take a screenshot of it. Now, if this is the scenario, that's the number of days that I'm gonna allocate to each subject. To the anatomy, I'm gonna give 19 days or 12 days, physiology 9 days, biochemistry 9 days, pathology 14 days, microbiology 12 days, pharmacology 14 days. A lot of time people ask me, sir, if the number of questions are 200 and you are dividing it into 200, why don't you give the equal number of days? No, the number of days are dependent on the number of questions that are asked from that subject, along with that the complexity of that particular subject. So on the basis of complexity as well as the relative importance and the integration, the number of days has been divided. If you're gonna calculate, if you're gonna do the sum up of this, this will be 200. So that means in order to complete your first reading, you need broadly 200 days, and these 200 days will take you towards it's neither too less nor too more. So that means around 6.5 months. Around 6. You can, as a ballpark figure, you can take 7 months. So that means you have to complete your first reading between 6 months to 7 months. And 6 months to the 7 months is the time. And good evening, Dr. Ashwini. Abhi, we are just discussing about your subject only, that the first reading of the anatomy, you should give around 12 days to the anatomy. And that is what we were discussing. But I'm going to talk about the offline, online. Just give me a time. And that is how the questions has been structured. So this is a broad idea. And that is how a student has to plan their course. You can slightly change the days, the number of days into this, but if you want to stick to them, this schedule is not gonna disappoint you. Now, what is the difference between preparation for the NEET and the NExT? Now, let's take about this particular part. Do we expect that the NEET is gonna be there or the NExT is gonna be there? So let us understand that what are the challenges that are happening. If I tell you that there are two aspects of the exam conducting body. One is the actual exam conducting body, which is made up of consultants, advisors, and bureaucrats. If I'm going to talk about consultant, advisor, and the bureaucrats, they are hell bent on this, that they want the exam to be conducted in December 2023. That means 2019 batch will be the first batch who's going to be writing the NExT exam for the first time. However, in the original draft, there are some questions that they could not address. They have also asked for the suggestions, and I think some of you have already submitted your suggestions also. I have also submitted them these suggestions. One of the biggest suggestion, that first suggestion that I gave to them on the email, which I'm sure all of you have also given, is it's absolutely absurd to have the average of 3 scores, and I can tell you that this is gonna go without a doubt. This is definitely gonna go without a doubt. So this is not gonna be there. The second big challenge that is coming up is that if 2019 batch is gonna write the NExT exam, and which is NExT 1 exam, they have already completed the third year. They are already given the exam for the third year. Why they should be subjected to that exam again? And that's a real question. I mean, why you are putting the stress of giving the exam to the student again and again? And that's a real challenge that they are also facing. Probably they are unable to answer that particular point, and at least they have not addressed it as of now. The second is that if 2019 batch write the NExT 1 exam, which is supposedly a PG entrance exam also, and they do NEET and NExT both, and tentative date of the NEET is March, then that means that the PG entrance exam of a 2019 batch will be given before then the 2018 batch, which is again illogical. So these are some real challenges that are being addressed. Another point that a lot of students have sent it to me, but I think they have an answer to that, and that is the NExT one. If you write it and you want to improve your score, you can write it only after 1 year after completing the internship. But that 1 year is basically means if you have written it in 2023, you will be able to write it after in 2025. That means December 2025 that you will be able to write it. Okay, but so there are some challenges. If the government will be able to provide an answer to them, they're gonna try their level best to do the exam in 2023. Otherwise, expect a delay for an year or so for this. Now, what is the difference? I will say apple will remain an apple. Please remember this. In preparation, this is the broad difference, that the NEET is a 1-day exam and the next one will be a 3-day exam. Instead of, now I should not say 300, instead of 200 questions, there will be 540 questions. There will be 540 questions. The NEET exam used to be more of one-liner. This they have already changed. And now there will be problem solving, comprehension and analysis, and recall. Instead of 1 paper, now you're gonna have 6 papers. And now you're gonna have 6 papers, and previously there was no link with the practical knowledge. Now you have to clear the practical exam as well. So now the point is, this they have already changed. This they have already changed. That means that the paper has, in the NEET also, the paper has become clinical. The only big difference, if you ask me, is 200 and 540 question and 1-day exam versus 6-part exam. So that means you have to grill yourself slightly more. You have to prepare yourself that how to write the morning and the evening exam. So it is only the pattern of the exam that you need to be worried about rather than anything. Nowadays also, majority of the questions that we are getting in the paper are problem solving, comprehension and analysis. You know, a patient presented to you with this, he has these problem. Now what is the next step in the management of the patient? This is a problem solving question. This is a problem solving. A patient has difficulty in breathing, his pH is this, his bicarbonate is this, his PO2 is this, PCO2 is this. On the basis of the finding, what is the diagnosis? This is the analysis. You analyze the result and then you reach to a diagnosis. These questions are still being asked and they're gonna still being asked in the future also. So this is the real difference, and that is 200 versus 540 questions and 1 day versus the 3 days, and that's all. Okay, one big difference is obviously versus the pre-internship and the post-internship exam. Yes, that's a real difference that is there. But I always believe hope for the best, prepare for the worst. Hope for the best and prepare for the worst is the simplest principle that I have always followed in my life. I do not want a surprise which is not pleasant for me. I will be happy with a surprise which is pleasant for me. If I am prepared for the exam in December and if it happens later, it is still okay with me. But if I am not prepared with the exam in December and it happens in December, that's a problem for me. So that is how I am gonna go with that. If you ask me today, for interns, obviously interns, they will be writing the PG entrance exam. For final year MBBS student, I want consider that you will be writing the next exam in December. Okay, now that is one probability that is there is there could be a separate NEET exam or a NExT exam, and there is a probability that both the exams are clubbed together also, and there is no as such clarity on this as of today. Okay, so that is my broad stand on this. All right, now let's talk about this. Do I need to join any institute or I can study on my own? And if I need to join an institute, which course I should join? So first of all, please understand, and I'm a very, very firm believer of this, please, what I commonly say, don't follow herd mentality. दिखावों पर मत जाओ, अपनी अकल लगाओ. First ask yourself that where do you stand and why do you need an institute? What is coaching? Coaching is a hand holding. Coaching is to provide you a support to make your journey easy. You are trying to swim across a river. Now if somebody asks me, can you swim it on your own? The answer is yes. Coaching is a boat. I will provide you a boat and it will be easier for you to swim across the river or to cross the river. That's all. Whether you want this boat or whether you don't want this boat, that's totally your choice. If somebody asks me, sir, can I cross the river without the boat? The answer is yes. Will boat be helpful for me? Answer is yes. Answer is definitely yes. So you have to identify that where do you stand. Nothing can replace standard textbooks. There is no doubt about it. We as a teacher try our level best to provide you that hand holding so that your life becomes, your journey in this become less stressful and more easy. You can do it without us also, you can do it with somebody else also, or you can do it at your own also, or you can do it with us also. That's totally up to you. All right, according to me, whatever that I have observed in last so many years, it is easy if you get a hand holding. If somebody guides you, somebody mentors you, it is slightly easy for you. Okay, so now if you have to join, there is a big confusion nowadays. What should I join? Whether I should join face-to-face classes, whether I should join live internet-based classes, or whether I should join recorded lectures. And there is a big challenge. What should I do? Everything has its own advantages, own limitations. So what is the biggest advantage of face-to-face classes? Face-to-face classes is the complete hand holding. It's a 360-degree support. The only thing that you have to do is you have to follow blindly what has been told to you. That's all. Close your eyes. Every day in the morning, whatever somebody tells you, just follow that. And that's all. That is what is the face-to-face class. You will come into the class, Dr. Ashwini will teach you anatomy. You have read anatomy. After going back from the class, you have revised whatever that you have read. You are solving some MCQs, which is the previous year MCQs or the QBAN. You are adding GT, which we're gonna talk, and done. अपना दिमाग लगाना ही नहीं है, खत्म. The kind of regularity that this course will give you cannot be provided with any other course. If it is so good, why even I'm mentioning the other two things? I should not mention it. It has its own challenges. One of the biggest challenge is the availability of face-to-face classes might not be present in your own city. That's a very, very big challenge. So what should I do? Shall I shift from my place to another place just to get the face-to-face classes? Yes, that can be done. And if you can manage it, but if it is breaking your rhythm, then that will be a challenge. But if you ask me, this is the single most important way of a complete hand-holding for any student. All right. The kind of regularity, the kind of discipline that you're gonna get with them cannot be compared with any other place. All right. Let us say that the face-to-face classes are not available in your city, but you want the same regularity, you want the same discipline, you want a schedule which you can blindly follow. You can blindly follow and can have the same integrity, and that is live internet-based classes. Live internet-based classes gonna work the same way as we are attending this session. You will have a complete schedule. You gonna learn in the same way. You gonna ask your doubts from the teacher. You gonna read in the class. You gonna revise it after the class, and you're gonna follow the same pattern. Plus, you're gonna get a short backup of the class also in case, because of whatever reason, you could not attend. However, the idea is to maintain the discipline. The idea is to finish the things there and then. So if the problem is that you are unable to travel to a particular place, then this is a boon for you. Now, let's come to the third point, recorded lectures. Recorded lectures, when first they were introduced, they were considered to be a boon. Why? Because now you are the master of your content. You can read whenever you want. Whenever you want. You are not in a mood of reading at 9 a.m. today. You want to read it in the night. You are a night person. You are not a morning person. And you always read in the night. You are the master of your own content. So that is the best thing that can happen with you, and that's a recorded lectures. But the problem is it lacks discipline. It lacks discipline, so that the things that you have to cover in 3 days, you are covering it in 10 days. You are covering it in 15 days. If you are dedicated, if you are motivated, if you think that you can read from the recorded lecture, it's also a good boon. It's also a good boon. But from my side, this is the priority order that I'm gonna do. Face-to-face classes, live internet-based classes, and then recorded lectures. Most of the time, they have enough content which can help you in cracking the exam. The biggest difference between them is discipline. How much discipline that you want, and the discipline is on the basis of schedule. Another common question that the student asks me is, sir, shall I go for a regular course or shall I go for a TND? And this is something that I want everybody to understand, guys. A regular course is a complete hand holding where the subject is taught from basic, from ABCD. Whereas a TND is your assessment and updates of that subject. Any student who has read the subject well previously should attend the TND programs. Any student who has not read the subject well previously should go for the regular courses. And that's a difference. In terms of assessment, I will say write a GT. Write a GT. If you are scoring above a 550 in the GT, or 500 for that matter, 500 above in the GT, you are a candidate for a TND program. But if you are scoring less than that, if you are scoring less than 400 in the GT, that means your basic understanding of the subject needs to be strengthened, and then the regular courses is an ideal program for you. It could be face-to-face classes, it could be live internet-based classes, or it could be recorded lectures. Okay, now just at this stage, I would want to share with all of you on this point that DBMCI as an institute has all these options, and just in order to take care of the need of the recorded lectures also, we have our mentorship programs where we try to give you the schedule also, so what you have to do on daily basis. And so that is another area that you should be or you can do, but that is how you should select. For the students who cannot come in face-to-face classes, DBMCI is starting a new batch on the internet, and if you want to see how the classes are being conducted, so there is a master class that is happening on February 10. The link of that is given in the Google form. Fill that Google form and you will get a complimentary access of the class. Just see the class, how the class works, and then decide that is it your cup of tea or it is not your cup of tea, and according to that you can take a call. And that is how another thing that you can do. So there is a, in the description there is a Google form. Fill that Google form and attend the class on 10th of February. It's a pharmacology class, and just see whether you are meant for it or not. It is to be noted, guys, no medium is bad or insufficient. Learn concept and you can beat any exam without a doubt. Okay, so that's a simplest mantra. Okay, how much time should be given to theory and to the MCQs? That's again a very relevant question. So the point to be noted, guys, if your basic understanding of the subject is not strong, initially more time should be spent to the theory and less time should be spent to the MCQs. As your theory becomes more and more strong, then the time to the theory will keep on getting lesser and the time to the MCQs will keep on getting increased. The standard suggestion is, if you're already in a structured program, the standard suggestion is attend the class, go back, take a rest, revise everything that has been taught to you in the class, pick up a Q bank, and from that particular topic that has been taught to you, try to do some MCQs. A lot of time people ask me, sir, it is too difficult to do it. I say, bache, there are 2 lakh people who are writing the exam. You want to come in top 10,000. You have to do something different than rest of the 1,90,000 students are not doing. You have to do this. So attend the class, revise the class, and do the MCQs. This should be the motto. If you're unable to do the MCQs, just revise it, and whenever there is a gap between the 2 subjects, complete the MCQs in that time from a Q bank. Which Q bank? That's your choice. How should I prepare 20th notebook? Do I need to do this? No matter how much you read, no matter, whatever you're gonna read, you are bound to forget it. The rule says, if I am reading, there are 2 kinds of stuff that I'm gonna come across. One is conceptual, another is factual. It is extremely important to know the facts also. Don't think that the facts are not gonna be there in the paper. It's still gonna be there in the paper. Facts are forgettable. So the concept of 20th notebook is not to write concept, it is to write facts. Remember this, because facts are forgettable. The idea of creating a 20th notebook is to write those things in the booklet that you are likely to forget. And what you are likely to forget? So that is what you need to write in the 20th. The idea is, more number of topic, more close to the exam you can revise, better will be your rank. It's a competitive exam, not a qualifying exam. More number of topic, more close to the exam you can revise, better will be your rank. Last question. What is the ideal time to start writing grand test? Guys, I want to write it down ASAP, as early as possible. Don't wait for your course to be finished. Start writing the grand test, because it will reduce your anxiety don't bother about the score that you are getting. You have to follow the rising trend in the grand test. With every passing grand test, your score should improve. Even if you're starting with 200 out of 800, that's absolutely okay. I want to score 650 marks. I want to score 600 marks. I know what is the trajectory that I have to take. If I don't know the baseline, how will I decide which trajectory I have to take? So grand tests are to decide your baseline. Start writing grand test as early as possible. Initially, it should be one per month. As the time will pass, we will increase the frequency to 2 per month, then 3 per month, and then 4 per month. And then depending on the way that our preparation is going, we're gonna change it. Okay, so these are some of the standard questions that I wanted to ask you, or I wanted to give you my viewpoint to it. For those who have joined the DBMCI, I will be meeting you again and again in your classes. If it's DBMCI live class, I will be meeting you more often. If it's a face-to-face class, you can connect with me in the mentorship programs, or if you are a part of eGurukul, then again you can join our mentorship programs which we are doing. All I can say on behalf of the institute, identify that what do you need. We will find it out for you. We will try our level best to provide you the support that you are looking for. If you think that you can do it on your own, I will pray from the Almighty, I will pray from the God that you should get the rank that you deserve, you should get the rank that you're looking for. If you think that you need our support, we will try our level best to provide you the best possible support that we can. Okay, that's all guys from my side. If you have any questions, just put it and I will try to answer. Otherwise, these are some of the points that I want to give. If you want to join us in face-to-face classes, you can. Internet-based classes, which are the DBMCI live, as I have told you, 10th February is the new batch that we are starting. Fill the Google form and you're gonna get a complimentary access and decide it for yourself. Obviously, if you want to take up the eGurukul, you can take the recorded lecture access as well. Okay. Already passed FMG, and if you have already completed the internship, bache, then it's for you, it's just a PG entrance exam and then it will be next one. But you should have a internship completion certificate available to you. The day it will be announced, if you have an internship completion certificate available with you, then it will be only next one. But last question, Rishabh, main problem is how to revise bulky notes after batch is over in the last 4 months. So Rishabh, that's a main problem. That's absolutely correct. And that is why slowly and slowly what we're gonna do is we're gonna consolidate our notes in a way that we have understood the concept and we will be revising the facts. And that is what we're gonna do. What is the best preparation strategy for recently cleared FMG in the internship? Dr. Mohan, bache, to be honest to you, this video has specifically been prepared keeping the lot of requests that I have got from the wonderful result that the FMG students have got this year. I had a privilege of guiding so many students in the FMG screening exam, and the result was phenomenal. Some of them have scored so brilliantly that even if they write the NEET exam now, they can expect a rank in top thousands also. So just stay on track. But please remember, there is a big difference between the screening exam and the NEET exam. There is negative marking and it's a competitive exam. So your rank is dependent on how much others have scored also. So enjoy for a few days. If you have already done that, please pull up your socks and get to this battle again. I know that's slightly hard. अरे सर अभी तो एग्जाम खत्म करके अभी तो थोड़े दिन तो जीने दो. Agreed है. But it's a competitive exam. The earlier you start, the better is your result. Then that is how it is. Sir, what to do now if I'm eligible for the NEET PG 2023 after August extension? So, बच्चे, you have to think that in how much water you have. This is a problem in the north. In the south, it's not a problem. People don't consider that the post internship exam as their final exam, they usually attend the internship very, very seriously, and then they wait for an year, they prepare pretty well for an year, and they write the exam. All I will say, I mean, it's been more than now, how much time? It's been more than 18 years that I've cracked the PG entrance exam, and I don't think that anybody has asked me ever that in which year I have cracked the exam. So what matters is to reach to the highest of your potential rather than just pick up a seat on a half-baked preparation. That's what I say. Bache, so if you have got only 50 correct, then you must join ideally a face-to-face program, and irrespective of the institute, and follow it blindly. If you're getting 50 correct at this stage, close your eyes, and whichever best option that you're getting for a face-to-face program, just join that. Just join that, and that's probably the easiest way for you to reach to the rank that you're looking for. Okay, all right guys, so that's all from my side for the day. Please reach out to me. You can join DBMCI Premier Group. You can join my Telegram channel at Rajat Radiology Review. You can follow me on the Instagram. You can follow the DBMCI Premier Group on the Instagram. Whichever way that you think that I can help you out, do let me know. I will try my level best to provide you the support. Even if you are not a DBMCI student, do let me know if I can help you out in any way. I will try my level best to provide you the support, the best support that I can. Okay. Alright guys, so that's all. Thank you very much for your time, and do reach out to me on to Telegram or the Instagram, and I will try to address the queries as much as possible. Okay.